I have with me Jennifer, who's the next deputant, and she'll be continuing on the next spot, a frontline worker at the city.
Is that Stella?
Sorry, Stella couldn't make it.
Oh,
We
okay.
have Jennifer instead of Stella.
Okay, so you're doing combined together a little bit more, just so I get a sense of timing.
It should be work out to the 10 minutes still.
10 minutes? Okay, thank you.
Okay. And we have Simon, who's going to, from CUPE, who's going to show you the slides that we have. They're not as fancy as 4948s, but we represent more areas. Sorry. And so they're not as enticing, but anyways, they still hopefully tell a story. So we represent the frontline workers in many divisions. Frontline workers have been talking at these sessions about recreation, childcare, long-term care, shelters, and we want to make it clear what the impact of potential cuts are, staff reductions and fee increases embedded in this budget. We should start by expressing what we want the city to do. We want the city to be more fair, and that this budget doesn't make it more fair, it makes it less fair. We want to start by talking about what we should be doing, which is moving towards being a city that supports each and every community, a fairer city where everyone has access to the supports they need to make a better life. This budget, however, takes us in another direction towards a city where inequality is growing as services shrink. So I'm going to talk about a few examples of the service cuts in this budget, and these services are already underfunded, understaffed. First, to Parks, Forestry and Recreation, PFR. The recommended budget is 0.3 below the 2016 budget through user fees, staff reductions, and delays in service increases to keep pace with growing communities and the Council's own adopted recreation service plan. So I'm going to show you a chart now that talks about staffing. Staffing has been flatlined while use has risen by 22.25%. So we see the line at the top that shows increasing usage of our recreation facilities, and the blue at the bottom shows a decrease in staffing levels. And a review of the actual staffing versus services shows growth shows that while use of recreation has risen by 22.5%, 25% since 2010. Actual staffing in PFR overall has generally flatlined. Our own internal tracking shows that the city has over 1,000 fewer part-time recreation workers than it did in 2010. With this budget, proposed 192 positions in PFR to be cut. It includes hundreds of youth rec jobs, and we think this moves in recreation services in the wrong direction. User fees on programs are up 12.3% or more. Programs like kids gymnastics and homework clubs after school are being cut by up to, the fees are going up by 12.3%, and before and after daycare, aftercare costs at the city camps are going up by 37%. And I know there was a question last night when we presented in North York. These statistics are in the analyst notes, the briefing notes themselves. Now let's move to public health. Many people have spoken about the need to meet inflationary costs of student nutrition program while continuing to expand it. Why do we keep having to come back here year after year when we know feeding children is critical to their success? And for every dollar invested by the city in this program, 4 more come from other agencies and funders. But that's not only the case in Toronto Public Health. For most programs and services in TPH, we get $3 from the province for every dollar we invest. I think that should mean we would be maximizing our investment to get the best bang for our buck. We are not even meeting provincial standards, even though we only cover 25% of the cost. This chart shows on the top. It shows what the top line is: the food inspections required by provincial legislation and regulation. The highest bar charts are what we're actually doing, and if you can see between 2005 and 2016, that gap between our responsibilities and what we're actually doing is increasing. And I think the public deserves, those who depend on and want to have confidence in our Dine Safe program should have a right to know why this is the case and have it fixed. Long-term care. Long-term care has proposed a budget that is 2.4% below the 2016 budget, and I'm going to show you another slide. From 2012 to 2014, there were 34,777 shifts unfilled in our long-term care homes, 10 of them. We're very concerned about this. This is an ongoing issue, and we're willing to be partners to fix this issue. We recently had, over the course of the last 6 to 9 months, a labor management meeting in each of the homes, and we talked about why this is the case. There is somewhat of an explanation from management in terms of some of these numbers are full-time positions where someone retires or leaves. They're then backfilled with part-time positions. So some of these might be, we don't know which ones are covered, but there's up to 34,777 shifts unfilled. We want to find solutions to this, and we're indicating a willingness to work with the division to do that. But this is alarming to us. Our senior citizens and those others that are in long-term care facilities deserve better than that. Shelter, housing, and support, 20 positions being eliminated. I want to end by shelter, housing, and support, and Jennifer, as a frontline worker, will be speaking to that. We now know that some of these staff reductions will happen in referral and support services that help people move from shelters to housing. And again, that's alarming to us. And the 8 staff being pulled from the Adelaide Resource Centre to help that agency continue its work for the homeless is important to note as well. And we urge the city not to go in that direction. Earlier, someone indicated that efficiencies could mean more deaths on the streets of Toronto, and we have to look at it in that sense. If you're pulling support services from the homeless, that's indeed what can happen. Finally, another slide. Local 79 and others are part of a campaign with unions and the community called Toronto Can Do Better, because we can do better. And it's time that Toronto raise the money to find ways to make sure these services that are currently already underfunded and understaffed, that this trend turns around and we actually support people in need of these services. Thank you very much.
Thank you. Were you going to speak as part of your 10 minutes, or
Yeah, you want to speak and then questions? It's up to you.
Yeah, I wasn't sure how.
You said you wanted to do, you got 3 minutes left, so.
Sorry, I apologize.
Hi, my name is Jennifer Chandran. I work at Housing Connections, which is part of the Shelters Housing and Support Division. I was formerly an applicant rep, but we recently had that changed over to caseworker housing, and I've been with the company for 16 years now. The staff in the Shelters Housing and Support Division do not have an easy job. We deal with all types of clients, but the ones that stand out and need the most assistance are those who have no other place to turn to due to their issues, and there are vulnerable clients. There are various issues they're dealing with: physical health, mental health, addictions, anger, and feelings of helplessness. Where do they turn to help? When it comes to housing, they usually come to us. It can make for a volatile environment, one where you're on the balls of your feet to react to whatever may crop up. Sometimes the interactions are very positive, but sometimes they can go downhill very fast. This is a lot of pressure on employees to navigate these interactions so they end positively for both parties. Staff at Housing Connections do their very best to keep up with the ever-increasing amount of applications and documents that arrive at our office each day, the 100 or so emails that are sent daily, the priority applications that need to be handled with sensitivity and care, the escalated issues from counselors, agencies, and providers, going out and providing training and presentations to educate providers and agencies, answering calls, dealing face-to-face with our vulnerable population, and rolling out new programs such as the various Toronto Transitional Housing Allowance programs. We at Housing Connections attempt to keep the wait list of over 90,000 eligible applicants up to date, so when providers use it to house someone, the information is correct. We give suggestions to applicants on what they can do while waiting for subsidized housing, where they could go for supports. This is becoming harder and harder to do, mainly because of the increased volume, but what's scarier is trying to wrap one's head around doing all this work with less staff. Staff cuts will make everything worse. Less customers will be served, whether it's face-to-face or over the phone, whether it's processing the paperwork that will keep their file up to date, or whether it's the counselor with questions, an agency who wants answers on behalf of their client, or a provider who needs support. There will be less people on the front lines to provide support or shelter intake, less vulnerable people getting the chance to work with a caseworker who can provide them with support that will make their housing journey a success. And those staff who are left will have more on our shoulders. There'll be more burnout, more sadness, more frustration, more people disconnecting as they cannot handle the stress. The employer will see the results of a high-stress environment, and while cutting staff may look good on paper, the long-term effects will be devastating, both to employees and the people they serve. This job can take an emotional toll, a toll on your mental health, which can usually result in a toll on your physical health. But we come to work.
Wrap up, please.
I only have one sentence. We come to work every day because we want to help people make a difference, and we want to make a change for the better. A budget that includes cutting staff is not a good choice. Please, don't do this to our citizens and the staff of this great city.
Thank you very much. Are there questions? Councillor Layton?
Thank you very much. I believe you had the slide up there for the reductions at long-term care facilities, the realignment of staff, and the reductions to backfill mandatory educational training.
Yeah, we didn't have a slide up there on that.
Sorry.
But that is in the earlier, in one of the initial budget documents around, so the cut in long-term care, we're indicating that this is the gapping that's occurred over from 2012 to 2014. So we're saying it's already underfunding, understaffed, a lot of working short, a lot of shifts unfilled. We're saying on top of that, this cut of a number of hours that would, and that's one of the things, it's a cut in the number of hours that are used to backfill people while they're training. So
What kind of training would they be taking?
well, most of the city's training is now online, so they're giving online modules, and they're feeling increasingly the pressure to do those long online training sessions, modules, even when they're mandatory training associated with their work they do as registered nurses on their own home, because they feel the pressure of workload at work.
On their own time?
Yes.
Would they be offered time at work?
We're told they're encouraged to do it at work, but the fact is, because shifts are being unfilled, they have more residents to feed breakfast, more residents to clean, more residents to put to bed, and they feel pressured to do that at home. So while that's what we're being told in labor management meetings, a cut in hours to backfill will be increasing pressure for them to do that at home.
So let me just get this, the unfilled shifts. So this is, there's a certain number of shifts in a day for a certain number of employees, and they're going unfilled. Is that to meet the gapping target, or is that to, why would those shifts be going unfilled?
Okay, there could be various reasons they're going unfilled. They have a CCIU, which is a centralized scheduling unit, which we've tried to get some issues addressed with respect to. One of the reasons is we're told if the city, if that home, if filling another shift, inviting someone in when someone else is sick, put the city over its budget limit in terms of allocated hours, they'll not fill that shift.
And what kind of work would these individuals be doing at the facility?
They could be doing any of the above. They could be prepping residents for breakfast. They could be cleaning residents. They could be providing medication. They could be putting them to bed.
And how are we going to be providing better service with less staff doing those variety of things? Like I go to a restaurant, I don't think the less waiters is helpful, not to equate what they do to the waiters, but if it's prepping them for food, I doubt I'm going to get better service in a place with half the staff.
You're going to get worse service, and they're already feeling the crunch in terms of the ability to, for instance, prep all of the residents for breakfast in the morning without rushing them to make sure that they start their day well.
The shelter and housing support positions, what do we know about what those people do?
What our understanding is that it's the Resource Center, Adelaide Resource Center, and there's the other position, other positions that do such things as provide meals to residents in the shelters, and some of the referral to housing.
Had a lot of talk about the referrals in the last couple of days to shelters, particularly during the cold weather warning. What do we think the impact of having less people actually performing the function of giving referrals to send people to available beds will have?
Well, if we provide less support to those staff, have less staff referring people to get on a list to get the housing and work through that system, and the work Jennifer does and her colleagues is to manage that list and coordinate that list, we'll have people more people out in the cold.
Sorry, that's what you do in particular?
We at Housing Connections maintain the wait list to facilitate people to get housing.
Oh, on the housing list, not on the emergency shelters. So am I to understand this correctly, that in these two particular areas, we're going to get worse service for our seniors and worse service for those seeking emergency shelters?
That's correct, in our view.
Thank you. Any other questions? Councillor Carroll? No. Okay. Councillor Cressy?
Very briefly, I want to pick up on the concerning note about the loss of shelter staff positions that's proposed. I'm having a hard time wrapping my head around those exact positions and what they are. You mentioned that there are 20 positions.
Yes.
Can you break those down?
That's as far as I can break them down. So there's the positions associated with the Adelaide Resource Centre, and our understanding of those other positions are supports in the shelters and in the referral to housing.
All right, so I'll take it as a piece of work on our end, is to dig into that even further.
Yeah, I think those who are concerned about Toronto's homeless and supporting them are entitled to that.
You bet. Thank you.
Thank you. Seeing no other questions, thank you very much. Oh, Councillor Carroll had a...
If I can just clarify that, because since we've been talking about it during the day, but now we have the president here. My understanding is the reason you can't break it down for it is it's going to happen by attrition. So it's basically, you know roughly how many will retire each year. We're simply not going to fill them, leaving gap. We can't even be strategic about where the gaps in the shelter system will be.
Sorry, but
That's your
I
issue.
don't know that that's the case. The city manager made it very clear at the beginning of this budget process that some of the cuts would be attrition and some would be layoffs. So I don't know
Okay.
where these fall. It's not
Okay.
been communicated to us where these positions
In both
fall.
cases, less than strategic is, yes. Okay, thank you.
Thank you. Thank you very much.
Thank you for your time.